Hello, Michael Salas from Vantage Point Counseling, and thank you for watching this today. Common thing that I run into when talking with either potential clients or even clients that I already have is people are wondering a little bit about how sex therapy can help with a problem with male sexual dysfunction. And so I was going to take a little bit of time and just talk a little bit about ways that sex therapy can kind of help with that. There is there are a series of exercises that sex therapists are trained in to help people who are dealing with sexual dysfunction, whether it's premature ejaculation, low sexual desire, delayed ejaculation, or erectile dysfunction. Most of these include increased understanding of the body and what the body is, what kind of signals the body is giving to indicate arousal, to be okay with arousal. These are non-pharmacological based interventions. However, as a sex therapist, I certainly do refer to local physicians and urologists if there is a problem that really should be assessed, because a lot of times we do want to also rule out that there isn't an underlying medical issue that is causing this. If there is not, what we typically work with is trying to help you to understand any mood issues that you could be dealing with, whether it's depression or anxiety, and ways to sort of overcome those. Sometimes there's an underlying desire, an underlying sexual desire that is difficult to talk to your partner about, and so sometimes we try to figure out, is this something that we open a doorway to discuss, or at least accept yourself, so that you are able to find a way to talk with your partner about it, open up about it, utilize fantasy. There's a bunch of different possibilities there. Other times people are uncomfortable with levels of intimacy and a vulnerability. It feels too vulnerable to be in a sexually intimate situation, even with their partner. And this can result from a variety of reasons, including sexual trauma, attachment issues, on and on. So, what we try to do in those situations is do a little deeper work. Sometimes it might be some trauma-related work, like somatic experiencing, EMDR, and other times it might be more talk therapy to try to draw lines between, what you're currently dealing with, and kind of drawing a connection to something that maybe happened in your past. And that understanding a lot of times can open a doorway so that there can be some work that you can do to sort of free up whatever is blocking you in that situation. So there's a variety of ways that, in sex therapy, that we kind of go about tackling an issue for men who are dealing with sexual dysfunction. It can be pretty complex. It can also be pretty simple. And so it always kind of starts off with, just an assessment of the overall issue and treatment plan, to kind of determine, what direction, that you and your therapist are going to kind of go in. And so one of the things I would say is it's really important to find somebody who has a good education in sex therapy. Sex therapy is not something that is spent on in most master's and even doctorate level programs. They don't spend a lot of time talking about human sexuality and interventions that you can use. So that's why ASECT, the American Association of Sexuality Counselors, Educators, and Therapists, maintains a database of people who are certified in sex therapy and sex counseling to help people with this. But those people have extensive training in sexuality And so it's really something to keep in mind as you're looking for someone to help you with this.